as I was saying before I was rudely interrupted, lub-dub is 1 heartbeat, so it's the 2 valves closing. So you would listen for 1 minute, and that would be the apical pulse, the number of beats that you get. So before we go any further, let's talk about your stethoscope. Do some stethoscope 101. This is a stethoscope. Hopefully you have one at home. So these are the binaurals here. They are movable. You should move them to fit into your ears. So you want them to kind of scoop into your ears so that they're comfortable and you could hear better out of them. So they should be facing towards your nose. They move back and forth. They face towards your nose. You don't want them facing backward because then you're going to have a hard time hearing. This is the lumen. This is a single lumen. Some stethoscopes have a double lumen, and that's fine. It's just a different type of stethoscope. You'll still be able to hear out of it. For these purposes, it's fine. This is the end here. You have the diaphragm, which is the larger piece. That's the part we're going to be listening through. And then this is the bell, the smaller piece. So in this class, we don't use the bell for anything. You'll use that in nursing school when you start listening to different things. For us, we just need the bell. So you're going to put the stethoscope in your ears and just lightly tap on the diaphragm. You want to be able to hear it. If you don't hear it, you might need to turn it. Okay? Turn it until you can hear it pretty well. So that's your stethoscope. You may get an order one day for an apical radial pulse. To do that, you need 2 people. This is for somebody who probably has some type of heart issue. Maybe they have an arrhythmia. So we need to see if their heart is pumping effectively to reach their extremities. One person's going to be listening to the apical pulse at the same time that someone else is taking the radial pulse. So you're going to do that for 1 minute, and then at the end of the minute, you're going to compare your results. If there is a difference between the apical pulse rate and the radial pulse rate, it is called the pulse deficit. So let's say I get an apical pulse of 80 and the other person gets a radial pulse of 60, that would be a pulse deficit of 20. And that would not be a good thing. So the respiration, we're going to count respiratory rate. Inhalation and exhalation is considered 1 respiration. So basically, we're going to watch somebody breathe for a minute. This can be a little awkward, so we don't tell the person, hey, I'm going to watch you breathe for a minute. A lot of times we just, act like we're getting a pulse, but we're actually watching the chest go up and down. So 1 inhalation, 1 exhalation is 1 respiration. While we're watching that and counting, we're also looking at the rate, how fast they're breathing, the rhythm. Is it regular, irregular, and the depth? Are they taking real deep breaths? Are they using the accessory muscles, in between their ribs to try to get that breath in? Does it look like there's a lot of effort being involved in breathing? Those are all important things to note. And obviously you would want to tell your nurse if you see anything like that. Normal respiratory rate is between 12 and 20. There's different things that can affect that. If somebody's sick and they have pneumonia or something, their respiratory rate might go up. So, or if they're having a hard time breathing, or if they've just had some strenuous activity, their respiratory rate's going to go up because their oxygen demand is up, right? Or there's some kind of interference, maybe it's mucus or something that's in the way that they're trying to have to fight through. So they're fighting harder to breathe. If you have anxiety, sometimes your respiratory rate will go up. If you're in pain, if you're scared, if you have a fever, sometimes the respiratory rate will go off because they're trying to blow off some of that heat. If somebody's had a head injury, it might have affected a part of their brain that's telling them to breathe, so their respiratory rate might be lower. And then there's some medications that people will take that can affect their respiratory rate. The main one that comes to mind are narcotics, opioids. They can lower the respiratory rate because they shut off the air hunger. So if you think about somebody who overdoses, like on heroin, it's probably because they stopped breathing as much as they needed to, and they suffocated because it's just shut off their drive to breathe. So important things to know here when you're doing this as a skill is to make sure that you are not telling the person that you are counting their respiratory rate, and don't instruct them on how to breathe. Don't say, okay, just breathe normally. Nothing about that. You can just say, hi, go through your regular indirect care. I'm so-and-so. I'm here to take your vital signs, right? You're not lying. You're just not going into depth, because you'll notice when somebody's counting your respiratory rate and you know it, you start breathing weird, and then we're not going to get an accurate reading. So this is the big one. This is probably the toughest skill that you learn in this class, is how to get a blood pressure. So there will be a separate video that goes through this step by step, and this is something you're definitely going to have to practice. It's not something that you're great at the first time you do it, so don't get too frustrated with it. It takes a long time to really learn this skill. So they keep changing the range of what a normal blood pressure should be all the time. Since I've been a nurse, they've probably changed it 50 times. This has kind of been consistent, though, that a normal reading should be around 120/80. If it gets above 140 systolically, which is the top number, or above 90 diastolically, which is the bottom number, that's when we consider somebody to have high blood pressure. So the systolic, the top number, where it's 120, that number is important because that is the pressure inside of your artery when your heart is beating. The diastolic, the bottom number, is the pressure inside of your artery when your heart is resting. We always measure this in millimeters of mercury, which is little m, big H, little g. That's how it's measured. We don't usually write all of that out. We usually just write, 120/80. But you'll see up here, mmHg stands for millimeters of mercury. You don't need to know for this class all the ranges for adolescents and children and infants. The only thing you need to know is the normal for an adult, which is around 120/80. If somebody's systolic is less than 90, if their diastolic is less than 60, that's when we start worrying about them having hypotension, which is low blood pressure. So anywhere around, 90/140 to 60/90, that's considered normal, although, it might be high or low normal. If it's outside of that range, you definitely need to let the nurse know. Some things that can affect blood pressure, cardiac output, how effectively the heart is pumping. The blood volume, if somebody's just been in a severe car accident and they've lost a ton of blood, obviously their blood pressure might be a little bit lower. If they've just had a whole bunch of salty food and they're retaining all this fluid, their blood pressure might be higher. Also, resistance to blood flow. So if they've got coronary artery disease and their blood vessels are very resistant and scarred, the pressure inside of them is going to be higher because they're not as pliable. We often see that people's blood pressure increases as they age, but don't get confused and think that it's normal. It's not considered normal for anyone to have high blood pressure. Gender also can play a factor in this, especially if somebody's pregnant. They have a higher blood volume and sometimes their blood pressure can go up. And then race, ethnicity. So African Americans and Hispanic cultures, they sometimes have higher blood pressure. But again, the normal is the normal regardless of race, age, or gender. You really don't want a blood pressure above 140/90. High blood pressure is the number one cause of heart disease. We call it the silent killer because oftentimes people don't feel it and they don't feel a need to take care of it because they don't feel bad. But the problem is doing severe damage to your organs over a long period of time that's irreversible. So it's definitely something that we need to keep an eye on. So once you've learned how to do blood pressure, you can bug all your friends and family, get all their blood pressure, and when you find out they have high blood pressure, then you can get on them to do something about it, right? That's what being a nurse is all about, is bugging your family to death. Okay, so important things to note when you're taking a blood pressure, make sure they're in the right position. So you might have an order to get a blood pressure while they're laying, sitting, or standing. Make sure that they're in the right position for that. They need to not be speaking because when you're speaking, your blood pressure is going to be slightly higher. Okay, and people love to talk, so you just gotta tell them, hey, be quiet for a minute while I'm doing this. Feet should be flat on the floor. They should not be crossing their legs. Make sure that you have skin contact with that sphygmomanometer. Make sure that you can actually use that arm. So if somebody's had any type of surgery, especially if they've had lymph node removal or mastectomy, for example, you need to make sure that you can actually use that arm. So ask them. Or if they have an IV on that side, it's probably ideal to use the other arm. And make sure that you have the right cuff size. So if you've got a guy with a huge bicep, don't go grab a pediatric cuff and think that you're going to get an accurate blood pressure reading, because you won't. If you have a cuff that's too large for that person, you're going to get an inaccurate low reading, and if it's too tight, you're going to get an inaccurate high reading. So there is a range on the sphygmomanometer, which you'll see in the blood pressure video, and you need to make sure that you're within that index, within that range. If not, get a different one. The last thing we're going to talk about in here is height and weight. You just need to know this calculation. 1 kilogram is 2.2 pounds. Okay, so the inches to centimeters we don't use as much, but we do a lot of calculating, especially when you take Math 129 or do any type of drug calculations. You have to know this calculation. You have to get it right every time. Okay, so make sure you also watch the video on getting somebody's height and weight. That is the end of this lesson. Lots of things to practice. Make sure that you practice them a lot so you get efficient at it.